The Mandeville Regional Hospital is the latest facility reporting that COVID-19 patients' occupancy levels are declining. Hospital officials believe the decline is directly linked to the recently implemented weekend restrictions. Shamela Pullen has that report.
Over the last few months, the Mandeville Regional Hospital had exceeded 100% occupancy level for COVID-19 patients. But now, Chief Executive Officer of the hospital, Alwyn Miller, says that occupancy level since the last 2 weeks has shown a decline.
In terms of the COVID ward, it is currently at about 55%. And remember that we are coming from in excess of 100%, right? So definitely an improvement. We want to see it continue to go down.
Do you believe this is attributable to the measures that have been taken?
Well, yes, I would say so. The measures have worked significantly in terms of reducing crowding, educating the public in terms of the protocols that need to be practiced, and to enforce the measures. So yes, I would say that they have helped.
Mr. Miller also reports that general occupancy at the hospital is down to 80%. He hopes that if the patient load continues to decrease, the hospital will soon be able to reintroduce other services.
But this, of course, is dependent on whether there is an increase in numbers, in COVID numbers or not, right? So we want to encourage the public to work with us and to try and keep the numbers down.
Mr. Miller was speaking following the donation of 1.4 million Jamaican dollars worth of ear, nose and throat ENT equipment by the Manchester Wellness Foundation to the hospital on Thursday. Meanwhile, ENT consultant at the hospital, Dr. Andrew Manning, says with this donation, the ENT department at the hospital will now be able to quickly identify and treat ENT illnesses.
We see a lot of cancers in Jamaica. We see a lot of cancers all throughout Jamaica, in central Jamaica. And prior to the advent of an ENT service in Mandeville, these persons would have to be sent, certainly in the public sphere, to either KPH or Cornwall Regional. And you know that they are already busy. So having the service here and having this equipment should also help to cut down on the waiting times.
Shamela Pullen, TVJ News.